Patients said, I just didn't have enough support. I felt very alone stopping my medication, and it was really, really difficult.
Like any other primary care provider in the UK, we do prescribe a lot of medications like an antidepressant. They are not the simple, straightforward medications that we might always think they are.
So the project aimed to improve the experience of care for patients who are prescribed benzodiazepines, Z-drugs, gabapentinoids, opioids and antidepressants. They're used to treat a range of different health conditions, things like depression, anxiety, insomnia and sleep disorders.
This is about drugs that create a dependence, and it's not great to be on those for long periods of time.
In reality, what will make them feel better is stopping the medication, but it's a lot harder, that process.
So if we can get people off those in a way that is safe and effective, that's great for the patient, it's great for the health service.
Everyone acknowledged that this was something that had to be done, but as to how you go about it, that was where the question mark was.
This study we saw as a tool to help us understand how we were prescribing certain medications at our surgery, and also how we could learn from our patients what they would like to see from us.
We did qualitative interviews with patients and healthcare professionals to get a better understanding of their experience. But then we brought patients and healthcare professionals together and said, okay, this is what you've told us. Based on this and your own experience, what do you think the priorities for service level improvement should be? We then said, okay, come and work with us to do some co-design workshops. So it was a really collaborative project right the way throughout.
In terms of Dr. Seddon's approach, she was incredibly receptive all of the time.
We have a range of different co-designed solutions that can be implemented at the GP practice level to improve the experience of care for patients who are prescribed these medications. So it was things like sending a text message at the point of prescription to give patients more information about those medications.
If people get the right advice when a medication is started, they're better able to make an informed decision about whether or not it's the right treatment for them, and therefore you're less likely to see any problems in the longer run.
We had a really nice conversation with her about how do we get your research into practice so that it can start having a benefit for patients, rather than waiting necessarily for a kind of national policy paper.
We also produced a range of different outputs, so things like clinical guides and videos for patients and webinars for healthcare professionals that hopefully will allow other people to pick those resources up and go, oh, I know what I could do next.
The approaches that we've adopted having gone through this study, I think have been very useful in terms of improving antidepressant prescribing here at Beccles.
Research quite often seems to be quite sort of top-down. This is what we think works, let's go out and do it. And that isn't the way our clinical practice is. It kind of makes a lot more sense to have this approach.
We're much more, what can we do actively that tries to make a difference?
And I kind of think that researchers should be almost an advocate or a voice for people with lived experience. We should be working to their priorities to make sure that actually this research is going to make a difference and it will have an impact for people who are ultimately the beneficiaries at the end.